What we're looking at now is burns, when the serious burns. In this case here, we've got a very bad burn to the chest. So we have superficial burns here, which is the redness, partial thickness where you see the blistering, and full thickness where you see the brown and black area where the skin's physically burnt. Now, burns could be caused by temperature, flame, electrocution. You can also have chemical burns as well. But in this instance here, this is the thermal burn that's caused a multitude of different types of burns. So the first thing we need to do is cool the burn down, because this is going to keep on doing damage. So for that, we need to cool the area in clean running water for at least 20 minutes. Now that's a lot of water to find. You may have a problem with that. The other problem with this, because the layer of the skin protects it, if you're going to put dirty water on there, then the problem you've got then is infection is going to just get straight in. So this is a major problem. So if you've got loads of water, if you've got, you're on the side and you've got hose, something like that, this is where you want to hose it down and keep hosing that area. It will cool the burn and it will treat it really nicely and also reduce the pain. You've probably burnt yourself on a cooker, you pop it under the tap, maybe what, for a minute, 2 minutes, and then you walk away and then it starts hurting again. That's because it's still burning. You need to really cool through all of the layers of the skin to make sure it's fully done, and that's going to take around about 20 minutes. That's quite distressing, and also on a burn this size you're going to have problems potential of hypothermia to worry about, so you need to keep the patient warm. Now another product you can use are burn gel dressings. These again, with this you would obviously wearing gloves when doing it for real, but just tear the dressing open and inside there it will come out with a gel dressing. And this is like a foam, and it's liquid, and actually just on my fingers now it's quite cooling. So what you can do with this is you apply it on, and in a burn this sort of size you would need lots of these, and a lot of kits would have more than one in them. Put it over the whole area. Sometimes in them you'll have some spare liquid you can just literally pour out on top as well. You can also get burn liquids and sachets that you can put on top, but you pop that on to try and keep it as cool as possible. Now, when you're covering a burn, you couldn't put dressing on that's going to stick. So what we would do is put cling film on first, because we want to put cling film on and to form like a skin-like barrier over to prevent infection getting through. And also, one thing that causes pain with burns is the air contact. So once you do put cling film over, that can help as well. So you pop the cling film over it, and this one you just set layers on, because the skin's going to expand and get swelling. So if someone's got a burn on their arm and you wrap the cling film round tight, what's going to happen, it's going to swell up. So you would lay it on in sections rather than wrapping it round. So on a chest injury like this, cut off a piece, pop it on, pop another piece on, and then you can secure that in place with a bandage just away from the injury, so the cling film is held in place. Burns this sort of size, this is a very serious medical emergency. You're going to need to watch out for shock. You're going to need to look out for all sorts of other problems, and it's going to be really distressing for them. If there's clothing there and you can safely remove it, do so. But if the clothing is burnt in, then if you pull it away, you're going to just pull the skin away, and it's going to cause even more problems. So burns like this are a serious medical emergency, and just a small burn can put someone into shock. So something like this, definitely you would need to get them to emergency services as soon as possible.